first, I wanted to talk to you a little bit about the hurricane. So yes, I live in Brooklyn, New York, and luckily my family was spared. But what you see on TV is not exaggerated. It's not exaggerated at all. Thousands of folks, people of color, low income, are hurting, have lost everything, are in shelters, are wondering where to go, are wondering what to do. But let me tell you, you know how union members are. When they talk about, how magically all of the buses and the trains were out of the way, you know who did that? Transit union. When they talk about, the hospitals that got evacuated, 900 patients, that was a union nurse. That was an SEIU nurse that did that. When they talk about not one single patient had a bad outcome, even if they had to move in the middle of the night, in the middle of the storm, those are union doctors doing that. When they talk about everything below 30th Street, the lights were dark, but there is no muggings, everyone is safe. That's your brothers and sisters from 32BJ, the security guards, the housekeepers and janitors that made their way down there. And public, you go on, and every time you look at any story, just know that that's our brother, that's our, everything that's being attacked on the other side, cutting public employees as if we're not living, breathing people, mothers, fathers, daughters, this is what gives us our test and our testimony. So I'll tell you two stories. So one is I was actually driving around Lower Manhattan the day after the storm because a couple of our buildings were out. Some of our members were in one of our buildings as a shelter. And I'm trying to get more doctors and nurses into the shelters to do health care. And I ran into some of our members from the building and security, from the janitor and security guards union 32BJ on the street, who had done a 36-hour shift, had slept at the building, wanted to make sure it was saved. But you know how it is, you can't lose those wages either, especially if you don't know what's coming. So they can't, don't want to leave the job, but want to go home and check on their families. Don't know who's dead, if anybody's going to be found, but they want to be there at the job. And literally could not find a ride home from Lower Manhattan to the Bronx. And that's like $60 in a cab if you can find one. Subway's not working, but 36-hour shifts. And what is she thinking? Deborah Moore was thinking, what can I do to help my union be stronger here? How can we help each other? How can we make sure that our rights are maintained, that our supervisors are not using this as an excuse to abuse us, that we are using this as an opportunity to lift our communities, to build, to grow. That's what Deborah Moore told me as she went home after her 24-hour shift trying to figure out how to get back. And then I actually went as a doctor to give health care in one of the evacuation shelters, and I ran into two of our members there already volunteering with folks who were having nervous breakdowns, who have lost all their diabetes medication. Imagine if you were just diagnosed with cancer and your hospital is closed and you don't know if you're going to get chemotherapy, And the doctor's sitting there smiling, talking about what can we do? How can we do more? We have 1 million healthcare members. We can own this and we can change this. We can have a test and a testimony on how we got through. So you will hear more about how your brothers and sisters are in the middle of this test and will continue, but with all of our support and your prayers, and I'm thanking you in advance because I don't even have to ask you if you were praying for us because I know. I can feel it. I know it. So thank you in advance for all of that. Thank you for your prayers, but you'll hear more. But just as you see all of that on TV, know that your brothers and sisters are front and center, and members and leaders like Doug and Diane Palmer in Wisconsin, folks are already trying to figure out what are we going to do to make this happen. And so, on that, the thing that really broke my heart on the evacuations of the hospitals, I don't know if you noticed, but a lot of those babies, right? You noticed the mothers were far away. They couldn't get to their babies. Now, you know what happens when a safety net hospital is threatened. And you all know why those moms weren't there with the babies, because they couldn't afford to stay there. They had no room at the inn, right? And because the hospital had been closed, the clinic couldn't, and this is why you're always fighting on Nashville General, because you know, right, what happens when it's not just about money or dollars, it's about care, right? It's about it's more than just the procedure, it's the care. And so There are reasons why we fought for decades for the Affordable Care Act, to make sure everyone has access to care, and we put money in our safety net hospitals, and we do all of these excellent things. And I'm proud to say that we have it, and we're going to implement this law. You know, we're going to continue to implement this law and fight for this law. But just know that when you see that, you know, that the fight still continues. I don't have to tell y'all that. Y'all in Tennessee. The fight continues every day. But there are so many things already happening. Do you know that millions of seniors in Tennessee have saved billions of dollars on their prescriptions because of the Affordable Care Act? Do you know over 1 million, folks have gotten preventive care exams through Medicare because of the Affordable Care Act? And you know how that goes. All your healthcare work, everybody here. What do they say? Ounce of prevention is worth a pound of cure. So, all of that is the law now. Can't discriminate against you on your insurance because it's the law. Can't overcharge you for your prescriptions because it's the law. Have to put money into community health centers because it's the law. That's what the Affordable Care Act and what it means. And so we need to continue to fight for that, and we will. And we know what that means in the election, right? We are clear. Every vote counts. And the last thing that I wanted to talk about, because I know there's prizes over there. There's awards under here. We're digesting a little bit, so, But the test and the testimony is that we know the health disparities that exist. We know the Affordable Care Act is our step. It's not the end-all, be-all, but we know how to work with a first contract. That's what we do. We make it better. But we're going to do that, and we're going to have a testimony on that. And the last thing I wanted to talk about was our vote. Now, I don't have to tell the folks in this room how important the vote is. I don't have to. Who's voted already? Hey! I'm sorry for having my radio voice on here now, but I've been talking a lot for these last couple of days, but that's what's up, right? The vote is like, it's our power. It is the, come on. It is so serious. And it's not an accident all these laws popped up in different states. It's not an accident that there were billboards in low-income communities targeted at communities of color that said you might go to jail and have a $10,000. Did y'all hear about that? $10,000 fine. Do you know that your union made sure that those billboards came down? That was your union, that was your members, that was our community partners saying that's not right. That's not right. If you have a problem everywhere. If you have a problem in the Republican primary. If you have a problem every day. Let's talk about how we're going to help people to vote and exercise their rights, not how we're going to shut people down and try to intimidate them. And so you all know, because I know a couple of you have been in Nevada and in other places working and calling and phone making and doing what you can do, and I don't care if it's a red state, blue state, purple state, yellow state, every vote counts. Every vote counts, because on November 6th, when we make the tally and the popular vote shows that we blew out of the water, that's what we want to see. And let's go